Hello and welcome. In this video, we'll be going over the steps required to fill the claim form for Care Health Insurance. So this claim form needs to be filled out in case we are going for reimbursement of our medical expenses which we incurred in a non-network hospital, or in case our cashless claim at a network hospital was rejected or denied and we want to file for a reimbursement of the same. So this claim form actually has two parts to it, part A and part B. But in our experience, we have seen that for reimbursement, part B, which is supposed to be filled by the hospital, is not required. So yeah, part A, this is supposed to be filled by the insured member. Now going over the various fields which we have in this claim form, it would be helpful if we have the policy copy or the policy PDF handy, because most of the details which are required in these sections need to be fetched from the policy document itself. So in section A, we get to see that we are supposed to fill in the details of primary insured. So primary insured is the proposer or the person who paid for the plan on paper. And that's the same person who can file for the tax benefits as well. So in section A, first of all, we see that we have to fill in policy number in this column. And as we can see in the policy copy or the policy document, we have the policy number right on the first page, also on the second page. So we'll just put in this policy number, and then the name would be of the proposer, which can again be fetched right on the first page. The letter, the policy itself is addressed to the proposer, and we can also find it on the second page under this policy holder column, followed by the address can be fetched from the policy copy. Once again, I'll just put in a random address. Okay, then the city name and all these details which can easily be found in the policy copy itself. Okay, phone number will again be, actually it will be redacted in the policy document. You won't be able to see the entire mobile number, but you can get an idea as to which phone number you have given as the registered phone number in your policy. So I'll just count down from 920. This is not an actual phone number. Email would be our registered email ID. Then moving to section B. So section B has details of insurance history. It's basically asking that the person for whom we want to file the medical expenses, are they covered by any other health insurance plan apart from this one? Okay. So in case you have a corporate plan, which is a company provided plan, or in case you have another health insurance, you can mention the details for the same along with the company name, policy number, and the sum insured. So in my case, that will be no. Then section C would be details of the insured person hospitalized. Now again, an interesting point here is that the proposer may or may not be covered under the current plan. Proposer or primary insured is the person who's just paying for it, right? Who is the proposer. Whereas details of the insured person has to be the details of someone who is covered by this plan. Okay, so details of insured person, here we can see. So accordingly, we can just put in the name of the patient. Okay, so again, it could be the proposer itself if it's a plan which covers the proposer. It could be for their parents, it could be for let's say their spouse. So accordingly, in this case, I'll put in my name, but we need to put in the patient's name here basically. The gender, the age. Okay, this is year, how many years you've completed and how many months. Date of birth. Okay, relationship with primary insured. So basically, what's the relationship uh, which the patient or the insured person has with the proposer? So if I have this plan for my parents, then it would be father, mother, right? Because they are my parents. And in this case, if it's for the same person, it will be self. Then we need not fill in occupation, address, state, phone number once again. This is not required. Moving on to section D, we need to mention the name of the hospital. I'll just put in Apollo in this case. Then the room category, if it's a daycare procedure, we can just select on daycare. If we went to a single AC room or a twin sharing room, we can accordingly select that. Then apart from that, we need not fill any other details, hospitalization due to, and all these things. The next important thing which we need to mention is the date and time of admission along with the date and time of discharge. So this is something which we'll be able to find in either the discharge summary provided by the hospital or in the final bill. So I'll just put in a random date, 20th of June 2024. Time could be, let's say, 1 p.m. Date of discharge would be 25th July. Time would be, let's say, 6 p.m. Then we again need not fill in these details. Section E, coming to section E, details of claim. So this will basically ask us for a breakup of all the treatment expenses which we are claiming for. So essentially we'll be filling in only these three: pre-hospitalization, hospitalization and post-hospitalization expenses. Okay, so just to explain it quickly, let's say we get admitted on the hospital on the 20th, okay, till 25th. Okay, and let's say we incur an expense of 50,000 rupees, okay, during the course of hospitalization. So again, depending on what the hospitalization is for, we might have also incurred some expenses before that. Now these expenses could be on doctor consultation, tests, any sort of medicines which we might have taken on OPD basis, right? So this period is known as pre-hospitalization period or pre-hospitalization expenses. Okay. So this is basically the time period or all the expenses which we incurred in relation to this hospitalization, but prior to this. Okay. And now depending on the plan which you have, it could be a period of 30 days, 60 days, 90 days, 180 days, depending on the plan. You can claim all the expenses which we incurred in relation to this hospitalization prior to getting hospitalized. And similarly, we also have the post hospitalization expenses. Okay. Now this basically refers to all the expenses which we incurred after taking the discharge. Okay, so this again could be on similar things. It could be on doctor consultation, medicines, tests, any sort of physiotherapy if it's an accident and the doctor has prescribed it. And let's say this comes up to 10,000 before hospitalization, and this comes to 15,000 post hospitalization. So again, depending on what's the period of coverage, it could again be 3 months, 6 months, something like that, depending on the plan. So we can claim for all such expenses which are, let's say, incurred on doctor consultations, medicines, tests, physiotherapy if prescribed by the doctor by submitting the necessary documents, even ambulance expenses, but only to and from the hospital. So if you are opting for ambulance expenses, it has to be for either 20th of, let's say, July or 25th. So either while going to the hospital or at the time of taking the discharge. So these expenses can also be claimed under pre and post hospitalization expenses. So we need not divide it further, we need not segregate it further. We just need to get these expenses under pre-hospitalization, these under hospitalization, and then these under post-hospitalization, and accordingly we can just mention this amount. So 10,000, 50,000 and 15,000. So even though we have these fields which mention the health checkup cost, the ambulance charges, but this need not be further divided. And then we need to put in the total amount. which will come up to 75,000. Okay, and this is the final amount. Just this is the amount which we are filing the reimbursement for. Now nothing else needs to be filled out in this claim form. Section F need not be filled because we'll be sharing all the bills. Section G need not be filled because we'll be sharing either the copy of our cancelled check or our past 3 months bank statement or the first page of our passbook, so that the insurance company knows the details of the bank account in which they have to make the transfer. Now again, the date is not required, the place is not required, only the signature of the insured is required. So if you let's say are filling this form on your PC or your laptop, you can just go to this website or any PDF editor, select the document which you want to edit, which is the claim form in our case. Okay, just go to the page where we are supposed to fill in the signature. You can also just have an image of your signature on your PC and basically just put it here, right there. Okay, and then yeah, edit the PDF, download copy, and we're good to go. Okay, so yeah, that's how we go about filling the claim form. I hope this was helpful. Thank you so much. See you in the next one.